Kids Back to Sport is a comprehensive support for parents, teachers, and coaches to empower them to achieve a safe return to sport for injured young athletes. One of the first injuries that young athletes present with is heel pain, and it's most commonly caused by a condition called Sever's. We used to call it Sever's disease, but it's not a disease at all, so that word has been dropped. Sever's is usually caused by a spike in activity that exceeds the current capacity of the body. That might be because the child did too much too soon, or they might have a lower capacity currently due to a virus, a growth spurt, or lack of adequate sleep or nutrition. Growth spurts start in the foot and ankle, and before moving upwards through the leg and the trunk. And it's for this reason that kids look like they've got huge feet relative to the size of their body. Bone growth puts more strain on the foot and calf muscles at the point where they attach to the heel bone. This is close to the growth plate, and as such, it tends to cause both traction, compression, and shear forces that act on the growth plate, causing inflammation and irritation. Severs is more common in boys than girls. If it does occur in girls, it's generally around 2 years earlier than in boys. And so we tend to see it around the age of 10 or 11 in girls and 12 to 13 in boys. It occurs when there's something in their normal routine that changes, such as maybe the start of a new season, a new term, a new school. Perhaps they've started a new different sport, or they've got new shoes. But relative to what they've trained for over the previous few weeks, these changes cause a spike in activity that exceed the capacity of the immature heel bone. The child will present with localized heel pain, which can radiate up into the Achilles tendon or down into the foot. It'll be worse on activity, and it'll settle with rest. And if this is not the case, it's less likely that this is Sever's. It will be tender to press or squeeze the heel bone, and sometimes it can even hurt over the Achilles tendon. But this isn't like in the adult. Children are really experiencing a problem at where the tendon attaches to the bone, not in the tendon itself. So the aim of treatment is to keep them as active as possible. If they do nothing, their tissues get even less tolerant of loading and the muscles get even weaker. However, it's important they do not cause more of an injury. I generally ask them these 3 questions. How much pain are they in? Does it settle within an hour of stopping their activity? And does it make them limp or have to play differently? If the answer is yes to the last 2 questions, they need to do less. We need to find a level of frequency of activity that reduces the pain back to being no more than a 2 out of 10 pain, and that it settles within an hour of them stopping. You can try some ice, but don't give your child painkillers just to help them get through a game. This will more likely make the condition last longer. The other thing that helps in most kids is using a soft heel pad made of a shock-absorbing material like sorbothane. This cushions the tender heel bone and makes walking more comfortable. Trying to get kids to do less is never popular, so try to find a way to increase the capacity of the body to tolerate more activity. Building stronger muscles and getting more sleep and improving their energy intake and factoring in days where their bodies can adapt and recover will all help. After the pain settles, be careful not to go straight back to doing what they were doing before. Build gradually up at the start of each new season or term and after injury, so that their body can slowly get used to doing what they're doing, adapt to that load, and make itself stronger. If after 2 weeks of trying to reduce their symptoms down, your child is still in pain, it can be helpful to see a health professional who has experience in treating young athletes. Not all practitioners have this knowledge, so make sure that you either look on the Kids Back to Sport register for a practitioner near you, or you ask your local therapist whether they regularly treat children with sports injuries and things like Severs. There's a download that you can get from the Kids Back to Sport website with more information about Severs and how you can help your child get safely back to sport.